Welcome back to Open Line on this Monday evening. For our Call the Veterinarian segment, we are joined by Dr. Logan Kopp. Call the veterinarian means call us. Go ahead, give us a ring at 615-737-7587. We want to hear from you, and I'm sure you might appreciate the free advice from an expert here and a fellow animal lover. You know, we were just talking about adopting and fostering, and I know that a lot of folks, as they get older in life, maybe they find themselves by themselves, are looking for companionship. And, you know, do you think that for folks who are, you know, at a more mature phase of their lives, should consider adopting?
I think again, it depends on the person. I have some wonderful clients who take wonderful care of their babies, and I know that I know of one particular who without her babies, I don't know what she'd be doing right now. So I think it is really important to think about that, but also they can really bring a lot of joy to your life. They can help you have a companion. You know, especially maybe you don't look for the super excited little puppy. Maybe that might be one you look for, an older kitty or an older dog. But I do think it is really a wonderful thing because they can just bring so much joy and happiness to your life.
Yeah, and we talked about in the last block how often it's the older animals, maybe the older cats, that aren't always at the top of the list for adoptions. But if you're at a phase in your life that you're not full of energy and you don't want an animal that's full of energy,
that might be what you need.
Exactly, right, just a companion to keep you company on the couch or on the bed, you know, kind of help keep you warm at night as you snuggle. But I do want to talk about fosters. That was something we were discussing earlier. Talk to me about the importance of foster parents.
Yeah, so we have some wonderful foster parents that take wonderful care, especially cats. That's kind of, we've got one client in particular who does a wonderful job. So I think it's a wonderful thing that you can consider doing, because you can help these cats, these dogs, these other small mammals while they're transitioning to their next home, and just give them a place where they can just be loved and not have to be in a cramped little shelter or things like that. But certainly I think that is something to really consider, because it can really bring a lot of joy to your life.
But again, just as, you know, adopting responsibly,
yes,
fostering responsibly, exactly. So talk to me about that. Do fosters incur the cost of the animal food and things like, or does it vary depending on the situation?
I think it really depends on the situation.
Okay.
So it depends on the community you're working with. You know, what do they do? So I know some will cover everything. Some don't, and so I think that's something that you really have to have an honest conversation with them before you get committed. You know, what is this going to look like? Making sure that we can make it work, and just give them the best place they can be.
Yeah. And I know that for me, fostering would be difficult because, what do they call it? Foster fails.
Yep.
That would you know, unless you want to end up with a lot of animals in your household, like we said, foster responsibly.
Exactly.
I want to talk about, you had mentioned earlier that canine flu was going around, and I think you said kennel cough as well. Tell me about that.
Yeah, so those are both upper respiratory disease, or they can cause lower, like pneumonia. But they're components of something called canine infectious respiratory disease complex. CIRDC is what I like to call it. That's the new name for kennel cough. But they can vary. I mean, kennel cough, if your baby's not vaccinated, it can make your dog very ill. They can end up on IV fluids and with IV antibiotics. They can be very sick there for a while. Same with the flu. I mean, just like people who aren't vaccinated can end up very sick. Thankfully, again, we have wonderful vaccines that are very effective at helping to decrease how severe the disease is. They don't typically prevent it, but they can make it much more manageable for your baby, and make them where it's maybe just a little irritating cough that we have to take care of. But definitely, those are some very scary things, and Nashville's definitely been a hotbed here recently, and it's very important to consider vaccination. Why?
Why do you think it's become a hotbed and we're seeing this uptick?
Yeah, that's a great question that I don't know. I don't know the answer to. So it's really interesting though. But hopefully people are a lot smarter than me, or looking into it, those epidemiologists and things like that.
I'm sure they are. Hopefully next time we have you on, we'll have an explanation for that. But I do want to ask, when it comes to the vaccines, is it like the flu shot for humans? You get it once a year, or is it a one-time thing?
Yeah, that's a great question. So typically, if we're talking specifically about the flu, so there'll be 2 doses the first time. So you get the first dose, 2 to 4 weeks later, get a second dose. After that, it is yearly. So it makes it a lot more affordable. And plus, it has very good protection as long as we do it about every year.
Yeah, and then I know, like you had mentioned earlier, this is the time of year that folks are visiting family, going away for the holidays, and they might be considering boarding their animal, and that's something that you have to think about as well, right?
Yeah, and we want to make sure that we plan ahead too. We get a lot of families who it's like, hey, I've got to get my dog boarded, and it's next week. Well, that vaccine might take 2 weeks, especially if it's the flu, and we need both doses. You might want to plan 6 or 8 weeks out. Make sure your baby's adequately protected before we go into a place where they might get it. And a lot of the boarding facilities are doing a wonderful job of trying to manage it and make the best of a bad situation. But again, I think that's where families can take a lot of that into play and talk to their veterinarian before Christmas comes around, because there's still plenty of time to get your baby protected before the holidays.
Yeah, and do you find that boarding facilities are requiring that your pet be vaccinated with, flu or kennel cough?
So a lot of facilities will require the 3 major vaccines, so rabies, distemper parvo, and kennel cough vaccine or Bordetella vaccine. And then with the uptick in flu, there's a hit or miss, but a lot of facilities, especially a lot of the ones around me, are starting to require that. And the flu vaccine is hard for us to find and stock right now just because of the supply chain, like everything else. And so that's making it a little bit more difficult as well. But certainly a lot of facilities and more are starting to require it.
Yeah, and I know often we try to protect our elderly as humans from diseases and things that are going around. Does that also apply to animals? Are they perhaps more immunocompromised with age?
Yeah, I think that is very much so what we see. So, typically your very young dogs and your very old dogs are ones that we get very worried about. The ones in the middle, they certainly can get very ill, but yes, as pups get older, then certainly we do see that immune system wane just a little bit.
Interesting. I want to transition because you said you don't only work with cats and dogs, you work with rabbits. That's one of your favorites. I think you said you worked with reptiles too, right?
The other doctor in the practice does.
Okay.
I like the little furry creatures.
Oh, I don't blame you. I do too. But when it comes to the the rabbits, the guinea pigs, should they get vaccinated as well?
Yes.
Okay.
So rabbits in particular. So this is one of my big passions right here.
Okay.
So there's a very bad disease called rabbit hemorrhagic disease, RHDV, and that is a very, very bad disease. It's upwards of 100% fatal in rabbits.
Wow.
And thankfully, it's not common in Nashville or Tennessee, but there's been at least one case that we know of so far. Most of the cases currently are out in the Midwest, where a lot of the hay and things comes from. The scary thing about the virus is it can persist for a long time in the environment, 3 months maybe. So that means that hay that we're getting from the Midwest comes here to Nashville, and if it has just a couple little virus particles, that could be really, really bad for your bunny. And so that was kind of one of my passions, is we were the first clinic in the state to offer that vaccine and to get everybody out and get them vaccinated. We vaccinated a significant number of rabbits. We've done hundreds and hundreds of them, and it's been a wonderful thing, and that's one of the big things that I promote, not only here but to other veterinarians, is trying to get more and more people to get their bunnies vaccinated, because it's a very serious disease, and when it comes to Nashville, it's going to be very, very bad, and it's better to have your baby protected with this vaccine that is almost 100% effective.
I know you mentioned that I think there has been one case in Nashville. Do you anticipate that there could be more?
There will be. It's only a matter of time, and it spread across Europe in just a matter of a couple of years, and frankly I'm surprised it hasn't spread across the country yet. So it will. There will become cases, and it will only get worse. And I should clarify, it was out near Knoxville is where the case was. But again, I don't think they ever figured out exactly where it came from, which is where it's really scary, because all it takes is, again, 1 or 2 little pieces of that virus can cause some really bad things for your baby.
Yeah. I want to continue with the questions, but just remind viewers, if you're watching this and you have a furry loved one and you have a question about your furry loved one, we have an expert here, veterinarian Dr. Kopp, who's more than happy to answer your questions. So go ahead, give us a call. That number is on your screen, 615-737-7587. We talked about vaccinating and treating our small furry animals like rabbits. Are there animals that are too small that you don't have to worry about? I'm thinking hamsters, gerbils. You know, do they need vaccinations?
So thankfully, currently rabbits are the only ones who do.
Okay.
But your guinea pigs, your hamsters, your gerbils, your little hedgehogs, they don't at this point. But yeah, they do require just a lot of good care. So that's something we want to make sure that they're getting as well, though.
Yeah, and I know this is kind of a big question, but I wonder, are there any illnesses or diseases that animals, your household pets, could get that could then transfer over to humans?
Yeah, so it depends on the species we're talking about. So say we talk about cats. One of the things that we worry a lot with cats, especially cats that were strays or shelter cats, is ringworm. Upwards of potentially 90% of stray or otherwise cats can have ringworm, and that certainly can cause illness in people. Things we worry about in, same with all our small mammals and guinea pigs. If you have a ferret, ferrets can get COVID, can get influenza from people, and they can also potentially transmit it back. So that's something that we want to be kind of aware of too. Thankfully, there's not a whole lot of diseases. Cats, you have something called toxoplasmosis, which a lot of maybe some pregnant women might be aware of. They don't clean the litter box, kind of thing. But there's quite a few of those diseases, and that's where it's really important to sit down with your primary care physician, your medical doctor, and then also sit down with your veterinarian and make sure that we can kind of tease all those things out and keep everybody safe.
Yeah, and we're seeing COVID and flu, of course, happen in humans. Is that something that vice versa you could transfer to your pet? Yeah,
so thankfully, especially with COVID, there's not a whole lot of risk. Certainly, there are some dogs who have tested positive, some cats who have tested positive. I know there's a lot with zoo animals and things like that. Don't do any of that work, but I've heard about it. But certainly, with ferrets being the biggest one that I'm aware of, certainly they can get influenza from people. Theoretically, they can get COVID as well. I don't think there's been that many cases of it, but it is just really important, just like you would anyone else. If you're not feeling well, maybe it's best not to let that baby lay on your chest. We don't want to risk them getting sick. It's probably unlikely, but let's do what's best for them as well.
Yeah, and I know we were talking earlier. I just thought of another question. With the holidays coming up, lots of folks may be getting a new pet for the family. But I wonder, when it comes to children, as the father of a 3-year-old, is there a good age to introduce a pet to your child?
Yeah, so that's a really good question. So I think it depends on the pet, depends on what you're getting. I mean, if you've got a dog, I think it's just one of those things that it's nice if they can kind of grow up together, because they can learn. I know my 3-year-old's growing up with the golden doodle that was kind of dumped at our clinic, and they just get along so great. But certainly, there's nothing wrong, and I think any age can suffice. The most important thing is just supervision. We want to make sure that that little 2-year-old, that little 3-year-old isn't doing something they shouldn't do, bopping them over the head like they like to do, wrestling a little too aggressively. Making sure that a lot of the times the puppy dog doesn't mean to hurt your baby, but if we're not out there watching, they might just want to be a little protective, and so keeping a close eye on them is really, really important.
Yeah, and I know that growing up, I was reminded as a child that this animal loves you, and I know you love this animal, but it's an animal at the end of the day, right?
Exactly, and they'll try to sometimes warn you, they'll try to get away, but that's where the parent needs to come in and make sure that we're keeping a really close eye on them, not leaving them unsupervised and things like that. We just don't want anything to happen to the human child.
Yeah. What about if your child has a fear of dogs? I know that's a common one.
Yeah.
Any advice to kind of help warm your child up to animals?
Yeah, so I think, that's a really good question. So I think it's, again, just maybe try to find that sweet little puppy. I think puppies and kittens is always a great way, but certainly maybe the older, calmer dogs as well. If you've got a neighbor who's got a really sweet dog, maybe they can learn how to play with them and learn how to kind of work with them. But yeah,
ease into it.
Ease into it for sure.
All right. Well, we have to go to another quick commercial break. We'll be back with Dr. Kopp right after this.